Good news, mamas-to-be. Oils can be safely used during pregnancy. Deborah Rayburn, author of Gentle Babies, says that though oils like basil, birch, calamus, cinnamon, cassia, hyssop, Idaho tansy, rosemary, sage, tarragon, and wintergreen are typically listed as oils to avoid during pregnancy, this is because they are usually adulterated oils. However, when using pure therapeutic grade oils such as Young Living and Common Sense, they can be used without problems. And further, Jane Buckle, PhD and RN, has noted that, and I quote, there is not a single record of an abnormal fetus or aborted fetus due to the normal use of essential oils, either by inhalation or topical application. There are no records of a few drops of essential oils taken by mouth causing any problems either. You can use oils with infants as well. Here are some tips. Eucalyptus, basil, juniper, peppermint, hyssop, and wintergreen should be avoided, as these oils are often too potent for tiny systems. Follow the gradual release method, which I'll outline on another slide, to introduce oils to your baby. Always dilute oils when you use them topically with an infant. Oil expert and author Sarah Harnish recommends using a natural lotion to do this. And follow your gut. If your baby seems to be sensitive to the oil in any way, stop using it for the time being. Here are the steps of the gradual release method. When first introducing oils to baby, just leave the bottle open in the room with him or her for a little while to help the baby become acclimated to the aroma. Next, using 2 drops in your diffuser, lightly diffuse for about 10 minutes. Then, using 4 to 6 drops, diffuse normally for 30 minutes or longer. Finally, apply the oil, diluted, to the bottom of baby's foot first. If the child is a toddler or older, you can then use the oil neat, that is without a carrier oil, if the oil is not a hot oil like peppermint or cinnamon. These steps should not be all done in one day. Space this over several days to help baby adjust properly to the oils. The same method should be followed for animals and the elderly as well. Okay, tips for using oils with toddlers and young children. Again, dilute the oil first. Only use pure therapeutic grade oils, no junk. If the child has been recently vaccinated or has a poor diet, oversensitivity can occur. Simply use caution and discontinue if they are sensitive to an oil. Stick to child-safe oils, some of which are listed on this slide. Diffuse only 6 to 10 drops maximum in your child's room. Less if the room is really small like my son's. I only use about 3 drops of lavender in his diffuser at night and it works wonderfully. If the child is sick, you can try a diffuser in the bathroom while they take a warm bath. Make sure you're using an approved cold air or ultrasonic diffuser. You can use a cold air humidifier as well to disperse the oils. And finally, internal consumption of oil is not recommended for children, though it may be okay for teenagers.